Hi there. So today I am coming to you to answer a question that was asked to me yesterday by someone who was interested in getting a knee realignment done so as to preserve their mother's knee who has got an early arthritis. Now, in order to explain to you further, I would like to brief you on the question, and that is whether the pain will vanish immediately after the procedure. So let's start. And I hope that after this, you will be able to be on board with me in understanding the intricacies a little bit better. Just a second. So as you can see, there are three images here. The first one, the second one, and the third one. Now, each of these represents something. I would like to bring your attention to the second image. In the second image, the limbs are straight. This is a normal limb. If I were to draw a line from the center of the hip to the center of the knee to the center of the ankle, it would be in a straight line. This indicates the normal distribution of the body weight. This is why when we walk, we do not have any pain. However, with time, with arthritis, in only one compartment, like I have shown in image number 1, what happens is that there's a slight deformity that develops. So if I were to draw a line from the center of the hip to the center of the ankle, it would offshoot and the line would be much further from the center of the knee. This is called as bow legs. And in early arthritis, this is what we see. Eventually, the bow legs keep on increasing, and a lot of patients come to us with a greater magnitude of this deformity, which I have shown you. Next, there's another deformity in which the leg can be positioned in such a way that if I were to draw a line from the center of the hip to the center of the ankle, it would again offshoot. This time it will be on the outer side of the knee, as you can see. Now, patients come to us with pain, and this pain is localized on the inner side, as you can see with the blue color tick mark. If at all, they have bow legs. If the pain is on the outer side, as you can see with a blue color star, this commonly is seen in patients who have bowing, which is outside. So this is called as knock knees. All right. Now, as a deformity correction surgeon and as a limb preservation surgeon, our job is to ensure that the axis is shifted adequately so that you can have a painless walk. Now, every good thing takes time, and so does this. So our goal is to ensure that in a case of bow legs, the alignment axis has to not only pass from the center of the knee, but a little bit off center, so that your hip, knee, and ankle, as shown by the long blue arrow, can be in a straight line. The same principles apply to those of knock knees. So here as well, what we do is that we try to preserve the bone in such a way that we can have the axis going from the center of the knee. Now, for this, we need to make a cut here, and we try and cut the bone here. Similarly, what we do is that we cut the bone here for a valgus knee and ensure that this can be easily done. Now, this can also be cut on the tibia. The final goal is to ensure that our alignment is 100% restored in such a way that we can get the normal axis. Now, coming to the question, after having understood this basic fundamental, what I would like to tell you is that there's a gap between the knee, which is going to be present at all times. And this gap can actually decrease with time. When it decreases with time, it leads to pain. And this pain can be on the inner side if you have bow legs, it can be on the outer side if you have knock knees. The goal is to ensure that there is adequate space for this to actually open up. And that we do by means of the realignment procedure. The bone above the knee and the bone below the knee need space to breathe. When it gets little space to breathe, the cartilage, which is overlying the bone, which could have been thinned out due to arthritis, can actually open up very well. And that space, when we provide by doing our realignment procedures, will ensure that new cartilage can grow naturally. Now, in this procedure, we do not touch the joint at any time, and we ensure that the knee is as naturally preserved as possible. So this is what takes about 6 months' time. But during this period, the patient will be walking, and a little bit every day, the pain will keep on going down. And like all good things take time, so does this. But the main purpose of me telling you all of this is that this can be done by natural means and by using principles of realignment so that your knee can be truly yours and not be replaced at a premature state by means of knee replacement. So this is all for today. I really hope that this video has been educational enough for you all to understand the purpose behind us going and trying to educate you on a daily basis. If you still have any queries, I'll be very happy to answer. Thank you.